Why do plastic surgery patients feel unheard by staff? Imagine going into a clinic excited about your transformation but leaving feeling like your concerns were just noise in the background. Many plastic surgery patients experience this frustration, and understanding why involves looking at communication, workflow, cultural factors, and patient rights. One major reason is communication challenges. Practices often handle a high volume of messages across different platforms like emails, texts, social media, and phone calls. When these messages aren't managed efficiently or integrated into a single system, important patient inquiries can get lost or overlooked. For example, if a patient reaches out via Instagram and then emails later, staff might not connect the dots, leading to missed responses. This disorganization can make patients feel ignored and frustrated, especially when they're seeking reassurance or clarification. Staffing and workflow issues also play a big role. Even with enough team members, if there are no clear protocols for tracking patient communication, responses can be delayed or inconsistent. Front desk staff might be overwhelmed or lack specific training on how to handle detailed patient concerns. When patients don't get timely replies, they may feel their individual needs aren't valued, which can diminish trust and satisfaction. Cultural and language barriers are another factor. Practices that serve diverse populations might struggle with effective communication if staff aren't trained in cultural competence or if there are language differences. Misunderstandings about expectations, risks, or desired outcomes can occur, leaving patients feeling misunderstood or dismissed. Since plastic surgery often involves nuanced discussions about aesthetic goals and potential risks, clear communication is essential. When it's lacking, patients might feel their hopes and worries aren't fully acknowledged. The complexity of patient expectations adds another layer. Many patients have specific aesthetic goals that require detailed, empathetic conversations. If staff aren't trained to engage deeply or don't prioritize listening, patients can feel their concerns are minimized or ignored. This is especially true when patients spend time and money on procedures expecting personalized care but receive generic responses instead. From an ethical standpoint, feeling unheard conflicts with core principles of patient advocacy and informed consent. Patients have the right to understand all aspects of their care, including risks, benefits, and realistic outcomes. When communication breaks down, it can undermine trust and make patients feel disrespected or unsupported. This can lead to dissatisfaction and even impact their overall safety and well-being. To improve this situation, practices can implement integrated communication systems that unify messages into one platform, reducing the chance of missed inquiries. Training staff in cultural competence and effective communication helps ensure all patients feel understood. Having clear protocols for follow-up and response times can make patients feel valued and respected. Most importantly, adopting a patient-centered approach that actively seeks out and addresses individual concerns fosters trust and aligns with ethical standards. In summary, patients often feel unheard because of fragmented communication, overwhelmed or uncoordinated staff, cultural and language differences, and the complex nature of aesthetic goals. Addressing these issues through systemic improvements and a focus on patient advocacy not only enhances safety but also respects patient rights, creating a more positive and respectful experience for everyone involved. Always remember, personalized, clear, and compassionate communication is key to building trust and ensuring patients feel truly heard.